Novo Nordisk is making big moves in the obesity space, reporting a massive 140% increase in Wegovy sales and expanding insurance coverage to 55 million people in the United States. But supply shortages continue, leaving patients frustrated as demand outpaces production. Meanwhile, new treatments like Cagrisema, Amycretin, and an upcoming oral GLP-1 could redefine weight loss medication if Novo can keep up with demand. Welcome to The Downsized. I'm Christopher Durham, and if you're new to our channel, we're glad you're here. The Downsized is where my wife Lorraine and I share our adventure with GLP-1 medications like Zepbound, Mounjaro, and compounded tirzepatide. And of course, we'll be talking about Ozempic, Wegovy, and a lot of other things today. Together, we've lost over 140 pounds and have experienced firsthand how these medications can change lives. But we also know that weight loss isn't just about the medication. It's about mindset, lifestyle, and understanding how to navigate this complex system. I started my GLP-1 adventure in September of 2023, and since then I've lost 94 pounds. I've transitioned between compounded tirzepatide, Mounjaro, and Zepbound, and through it all, I've seen identical results across these medications. It's been a journey filled with challenges and victories, and my wife and I share it all here. As always, I'm not a doctor, just someone sharing my personal experience. Be sure to consult your healthcare provider before making any changes to your treatment. And if you find value in what we're doing here, make sure to hit that like button, subscribe to the channel, and turn on notifications so you never miss an update. Today's coverage is based on Novo Nordisk's Q4 2024 earnings call, which took place yesterday, February 5th, 2025. The call featured remarks from key executives, including CEO Lars Fruergaard Jørgensen, CFO Karsten Munk-Knudsen, and other senior leaders. Analysts from firms such as JP Morgan, UBS, Bank of America, and Barclays asked pointed questions about supply constraints, pricing, and future drug development. Novo Nordisk had a massive year in 2024. It's no surprise to any of us. Their obesity medications brought in huge sales, and they say they're ready for even more growth in 2025. But the big question remains, can they keep up with the soaring demand for GLP-1s? Novo Nordisk CEO Lars Fruergaard Jørgensen opened the company's earnings call with a big number, 26%. That's how much the company's sales grew in 2024. Their obesity business skyrocketed with sales up 57%. More than 45 million people are now using Novo's diabetes and obesity treatments. We are very pleased with the performance in 2024, Jørgensen said. We see strong momentum in our pipeline. So let's talk about that GLP-1 boom and the supply issues. Well, Novo Nordisk remained the leader in the GLP-1 market. They now serve nearly 2/3 of all GLP-1 users worldwide. Wegovy alone saw a 107% jump in sales globally, generating 19.87 billion Danish kroner. Novo is a Danish company, so they report in kroner, but we'll translate it for you. The exchange rate's always moving, but as of today, that 19.87 billion Danish kroner can be converted to 2.76 billion US dollars in Q4. For the full year, Wegovy's revenue surged to 5.8 billion Danish kroner, or about 10.5 billion, representing a staggering 140% increase from 2023. Ozempic, their diabetes medication that is also used off-label for weight loss, brought in 127.3 billion Danish kroner, or 17.6 billion in the US in 2024, which was a 30% increase year over year. In the US, weekly prescriptions for Wegovy doubled over the year, hitting 200,000 by the end of 2024. Novo Nordisk's total GLP-1 franchise encompassing Ozempic, Wegovy, and Rybelsus generated over $28 billion in sales in 2024, firmly establishing the company as a dominant force in obesity and diabetes treatment. Currently, approximately 55 million people in the U.S. have insurance coverage for Wegovy, still a small fraction of the 74% of the people in the U.S. who are overweight or obese. So total U.S. population tops 340 million. More than 80% of those with insurance pay less than $25 per month for their prescription. However, despite growing insurance coverage, many patients still struggle with denials, high deductibles, and formulary restrictions that limit access to GLP-1s. Despite this massive success, Novo Nordisk has struggled to meet demand. We all know this. For months, there have been supply constraints, with semaglutide products regularly appearing on the FDA's shortage list. While the company continues to ramp up production, skeptics are questioning whether Novo Nordisk will ever be able to fully meet the growing demand for the medications. And those of us who actually take these drugs are wondering whether they are indeed out of shortage. Pharmacies and patients across the United States have reported ongoing shortages of lower-dose Wegovy starter pens, creating frustration for new patients trying to begin treatment. Meanwhile, Ozempic remains difficult to find in some areas, forcing diabetes patients to either ration doses or switch medications. These shortages have also fueled the rise of compounding pharmacies, as we all know, offering semaglutide alternatives, an issue Novo Nordisk has been actively fighting against. They are trying definitely to stop the compounding pharmacies, and they currently claim that Ozempic, Wegovy, semaglutide are no longer in shortage. The FDA has yet to confirm that, and of course we're skeptical. Supply remains our biggest challenge, Jorgensen admitted. We are expanding production capacity as quickly as possible, but the demand for GLP-1s continues to exceed our expectations. Novo Nordisk has invested billions into new manufacturing capabilities, including the recent acquisition of 3 Catalent production sites. However, the impact of these expansions will not be fully realized until 2026, leaving many patients wondering if relief is indeed on the horizon. Among the GLP-1 community, skepticism remains high. Many patients have been hearing for over a year that supply issues will improve, yet shortages persist. Some wonder whether Novo Nordisk is prioritizing high-dose prescriptions to maximize profits, leaving new patients struggling to find lower-dose starter pens. Others suspect the company's ambitious sales projections are at odds with their ability to actually produce enough medication. With compounding pharmacies continuing to fill the gaps, it raises questions about whether Novo can ever fully regain control of the market. Adding to the concern is Eli Lilly's aggressive push to expand its own GLP-1 production. With Lilly planning to boost production by 60% in the coming months, and most of us believing that tirzepatide is still in shortage, some analysts have questioned whether Novo Nordisk will be able to keep pace or whether Lilly will be able to keep pace. If Lilly can ramp up Zepbound and Mounjaro production faster than Novo can stabilize Wegovy and Ozempic supply, it may shift the balance of power in the obesity medication markets. During the earnings call, Novo's leadership acknowledged these concerns, but insisted they are committed to meeting demand. CFO Karsten Munk-Knudsen noted that their Catalent acquisition is part of a broader strategy to secure long-term supply. We expanded our GLP-1 patient reach by almost a factor of 2 over the last 3 years, Knudsen said. We expect to grow that by more than 30% in 2025. Let's talk about the future of GLP-1 medications at Novo. It rests in Cagrisema, Amycretin, and higher-dose Wegovy. While supply shortages continue to be a concern, Novo Nordisk is pushing forward with the next generation of obesity treatments. One of the most promising new drugs in their pipeline is Cagrisema, a combination of cagrilintide and semaglutide. In clinical trials, Cagrisema showed superior weight loss outcomes compared to semaglutide alone. In the REDEFINE 1 study, patients lost an average of 22.7% of their body weight over 68 weeks, and some lost even more. Amycretin, a dual GLP-1/GIP agonist, is also showing strong promise. In early trials, Amycretin delivered a 22% weight loss, similar to Cagrisema. Novo Nordisk plans to move Amycretin into phase 3 trials in 2025, aiming for a potential launch by 2028. The company is also working on expanding its Wegovy offerings with a higher dose 7.5 milligram formulation, aimed at patients who need a more flexible dosing option. In addition, Novo Nordisk is advancing research on oral formulations which could make weight loss treatment even more accessible. A semaglutide pill could reduce barriers to treatment, allowing more patients to benefit without injections. Stay tuned, though, as Eli Lilly is also reporting this week, and we will be back with more detailed coverage and insights. Thanks for sticking with us. If you found this update helpful, please don't forget to like, subscribe, and hit that notification bell. Let us know your thoughts in the comments. Do you think increased production will help? Let us know your thoughts in the comments. Do you believe that increased production will help bring prices down? Do you believe that oral medications can change the game? I'm Christopher Durham, and we are the Downsized. We'll see you next time.